So we'll go ahead and start our segment on consistent blood pressure measurement and follow-up in practice. And I just want to take a moment to introduce, for those of you who don't know her, Cass Riddle. She is our guest speaker today, and she is the clinic nurse manager at CCM Health. And then we're also joined by Amy Heikkinen, who's one of our wonderful colleagues at Stratus Health. She's been a facilitator for 1817 grant projects. So welcome to you both. Cass, did you want to just do a little brief introduction on yourself before we get started?
On myself. Sure. Hello, everyone. As Deb introduced, I go by Cass. My real name is Cassie, so I figured the shorter the better. So I have been here at CCM Health for about 18 months. Prior to that, I was with Caris Health, which was formerly ACMC. So I very much enjoy being involved still with that direct patient care and management of individuals, but I very much enjoy a lot of grant projects. So usually I'm the one to dive and really look at strategies and what we can do to accomplish and meet all grant expectations to make sure we continue to move forward in the organization. So with the work so far that we've been doing, kudos to Amy for her guidance and her involvement as well, but we've really been taking more of a collaborative approach with this granting and really working which ties into the presentation we just listened to about diversity. Even interdepartmentally working with individuals outside of your scope, that ties into it too. So what other information do you want?
That's wonderful. So I think that's a perfect lead into my first question for you. So thinking
Sure.
about a lot of our colleagues and partners have work underway right now doing that kind of annual refresher and training and focusing on our blood pressure improvement work in practice. And we've heard from a lot of project partners as well that many people are struggling with, short staffing or looking to fill open positions and trying to keep the work moving forward as they're doing that. So I'm curious if you could talk a little bit about how you've been able to keep the work moving forward and, staff training and education and really supporting that consistency in blood pressure measurement moving forward with your kind of particular reduced staffing situation.
Yeah, sure. So we have experienced actually a shortage in nursing here in the clinic, but it was related to retirements, and many individuals were riding on that fine line of do I or don't I? Well, then the pandemic hit and it made their decision for them. So we have been doing a lot of training and transitioning with new staff. Some of them have been prior students of ours. I do partner with a few colleges in the area as well as preceptors. So I will try to also look at filling those positions with individuals who did some of their externships in the clinic. But with that being said, competency in general was one of the biggest challenges that I took on taking on this role at the organization. Historically, they've had a very high turnover, not with clinical staff, but with administration and senior leadership. So that was something that really lacked. So as far as just even blood pressure, whether it's manual, automatic, we really utilize American Heart Association and the American Medical Association. And I did send some of those references to Amy and Deb as well to share with the team today. It's a great tool. It's something that you use at the start of your education for those medical assistants and LPNs and ancillary staff, but it also ties in on the end of a competency, whether or not those individuals had met the requirements, what to do following, and they've already done all the legwork for us. So if something works, I'm not someone who's going to reinvent the wheel. So this is primarily where our competencies stem from, are these two resources.
Great.
Circling back, Deb, to some of the turnover, I am very, very blessed. I had a clinic nurse educator who was shared between the clinic and the hospital. Unfortunately, that individual went back to get her master's degree and was offered a position. So we're looking at filling that. But I definitely couldn't do it without that team collaboration and that help. We really try to keep those in small groups.
Yeah, so your team that, so you work with, is it a clinic like team lead or someone like that to carry forward
Yep,
monthly?
so we're in a family practice setting, and I have identified a team lead within the clinic. She's also an Epic super user. She is an LPN. She is in school to go back to get her nursing, her RN degree, excuse me. But, and then also we had worked with the nurse educator as well prior to her leaving the organization. So.
Great, great. And for the blood pressure refreshers or trainings, do you do like a single large group? Do you do small groups? How do you like to do that?
Good question. Sometimes I'll do spontaneous ones and just walk through our nursing stations and just say, oh, I think I need my blood pressure checked today, you know, just to make small conversation, but it also just builds that relationship with staff. But I like to keep them in 4 individuals or less. Typically what we do, I manage, there are a little over 40 LPN, RN, and CMAs combined, and then we have providers in there as well. So roughly about 60 individuals. So what we'll do is keep them in groups of 4 or less. And then that way, when we have my team lead involved and also that nurse educator involved, we can do a lot of that one-to-one.
Terrific. Yeah, and I think that you shared that you do use this, the kind of positioning poster that I think we've seen previously from American Heart to help just level set with what we're looking for in terms of proper positioning and technique.
Yep, we do. Yep, and we also use that, the American Heart Association also has that in Spanish, but if some of you aren't familiar with where we are, we're in Southwest Minnesota, and we have a large population of Chuckies. So we also have that interpreted in that language as well.
Oh, terrific. That's great. So thinking a little bit about those small groups to go over the blood pressure technique and the competency, you did share that these tools from American Heart Association, American Medical Association are the ones that you use in practice. In those small groups, how do you do like the checkoff process? What works well for you? Do you do a lot of like video-based things? Is it more hands-on? What works for your team?
Primarily it's hands-on. What I'll do is try to get a little bit of an assessment and feel of everyone's learning style. I mean, and that's something too that I think individuals often forget about is what is the method that everybody is really able to grasp this process and how are they going to retain it. And even the majority of our staff prefer hands-on, but there are some that also like to watch a video first, whether it's a YouTube video or some type of scholarly video, just so they get a visual. Then they like the hands-on, or they like the hands-on and then reference a video. So we always try to incorporate and find those. And like I said, I've been a preceptor for Bridgewater College and Lakes Area College. So we have a lot of good reference as far as videos that are really up to date.
Okay, terrific. And then are there any like particular tools that you found most helpful in educating staff or keeping those skills fresh and on everybody's radar screen for blood pressure?
Oh, that's a great question. I don't know that there's any one specific tool that I think you have to reference many. Every situation is going to be different. Every, clinical staff is going to learn differently, and it's all about approach and educating and I look at everything as an opportunity, and maybe that's a learning curve for me too, in the event that they don't catch on right away. So.
Right. Yeah, and you've mentioned a few times the Target BP, that's the American Heart Association, American Medical Association toolkit. Just for the benefit of the folks on the call, they have really nice web-based tools. They also have a great, I'll see if I can pull it up here. So there's a number of kind of teaching elements embedded in the website that you can use in real time with your teams. And then they also have a really nice kind of a quick start guide for education. And it's got some really simple, quizzes, technique check-ins. It does have the links to their, if you do need some online video resources or online educational resources, there are a number of things listed here. And then they also have embedded in here, easy to access, little pre-post quiz technique check off kind of things. And then as we noted a little bit earlier, there are these tools. I'm just going to flip back to this one, more formal kind of check off, competency check off. These are standardized, validated tools that AMA and American Heart have developed in coordination with clinical experts and, you know, real nurses, physicians, medical assistants that are practicing in the field. So they're meant to be very usable. And do you happen to use, Cass, these particular tools to do your competency checkoff?
Yep, you got it. Yep, and then they go in their personal file. Yep.
Perfect, nice. So I'm curious, it sounds like you completed your kind of annual update refresher in, I think you said April.
Yes.
And then, so they've had their update. How are you using this more accurate data to continue to connect with patients, track them, do follow-up? Can you talk a little bit about your process and maybe some of the innovative partnerships you have?
Sure. Well, let's see here. So I utilize our home care staff quite a bit. Just a little bit of the grant work that we have been doing. We use a software called Livestream. It's a clinical support software where patients can record their vital signs from home, and then it's uploaded via Bluetooth. So that is something where we might not have patients who come in routinely for blood pressure, you know, any type of vascular, weight, diabetes, but we are still managing them with our care coordinators remotely using that Bluetooth technology. So I did share some of that as well. Reason why collaborating with interdepartmentally is so important is our home care staff are the individuals who will go into the homes and do competencies with patients as well to make sure, do they know how to check their blood pressure? Do they know how to manage the equipment that we have on hand? So that is another key important aspect is we don't charge for this service, but we do have the care coordination encounters for it. But it's just very important where you have staff and this I think is just the future of healthcare. The more we can do remotely and still be able to coordinate patients' care and making sure they have positive outcomes, we're going to be far more successful. So on the slide that Deb has kind of behind, I'm sorry, my computer's trying to do an update. So it's really not behind on anyone else's screen. Let me just minimize that. Right now, I kept all the patient information out, but what I'm showing right now is a trend and where we're at with settings within this Bluetooth technology. These patients are able to have ranges for their weight, their blood pressure, their pulse ox, their heart rate, etc. We're not doing diabetes yet. That's another project maybe in the future, but they do have that option as well where they can have their blood glucose is uploaded virtually using Bluetooth as well. But this is just kind of a little glimpse of the program and what that looks like. And what you'll see on June 9th, it looks like that was just performed this morning, and it gives the vital signs that the patient did check and then also includes some answers. So we, on the flip side, can create questions that we want to ask patients, whether it's related to, so this project specifically, hypertension, we ask the patients, you know, are you having any swelling? Are you having any shortness of breath? And we can create those questions so then the patient can communicate with us. So this second slide is also just a little snippet of what we see on our end as nurses, and it will alert us. So obviously green is great and it's within limits that is set, and those parameters are orders set by the provider, and then our home care team goes in and sets up the equipment, and they also enter all of the parameters for the patient. So then you can have an idea of who's managing this and when. And Monday through Friday, our care coordinators manage all of these patients and the vital signs. On the weekends and holidays, that is where our home care team comes in again. Without collaborating with other departments, we would not be able to maintain the expectations of checking these patients' vitals every day. On the top right there, you will see that we have two questions in there right now that are pretty standard. And like I said, one of them is, have your ankles been swollen more than usual, or are you experiencing any difficulty with breathing? So if any of those questions that we create are answered with a yes, we'll also get an alert from the patient. And then our care coordinators will communicate with the patient and give them directions off of standing orders. So.
Perfect. Lovely. Well, this is great information. We really appreciate you sharing it all. I think we'll go ahead and take a quick pause to just transition to opening up for questions. So those of you on the call, please feel free to be thinking about your questions. If there's anything that you did want to get in touch with Cass about to follow up on the information that she shared today, her email address is included here. It's cass.riddle@ccmhealthmn.com. You can also check out more about the clinic and their work online at ccmhealthmn.com. And I did include the telephone number for the main line for the clinic if you did want to reach out by phone. In addition, if you want to follow up about anything that you've heard from this recording, you can contact the MDH Office of Statewide Health Improvement Initiatives at the telephone number and web address at the bottom of the screen. So we'll just pause for a moment and then open up for questions.